third community connection event this year. This is mental health awareness month. And so we are featuring two fantastic mental wellness focused organizations, the Bullying Recovery Resource Center and Spark the Change Colorado's mental wellness program. And we're going to hear from Drew Alberg with the Bullying Recovery Resource Center first. Go ahead, Drew, take it away.
Thank you. It's not easy to say, is it?
It's a bit
if
of
I
a
say
mouthful.
it too fast, it looks like sounds like I'm bowling.
Yes.
So that's me, and that's our logo and email address, as well as my phone number. So I'll tell you a little bit about who we are. So a couple slides up, I think I don't know why I threw that in there, but I did. So the next slide says who we are and our mission. So I'm going to tell you that our mission is to defend bullied children and help rebuild lives. I'll probably tell you a little bit about how we started and why that's our mission here in a minute. So, and then the next slide is our vision. And we envision that all Colorado families experiencing bullying are empowered through education and advocacy to defend their children where the bullying occurs. And we are committed to building a community of support to help families rebuild and recover together. So I'll explain a little bit about how we do that. Just a little background, we've been around. We got our 501c3 in 2017. And we really began our work in earnest in 2018 when we opened up our doors and we started working one-on-one with families. Actually, we started before we ever opened up our doors. I'm also a co-founder as well as the executive director. My husband and I are co-founders. Our son, when he was in middle school, it started in 7th grade, and in 8th grade, it got really. It started in 6th grade. He was bullied at the very end of the school year. And then he was bullied for the majority of his 7th grade year, to the point where he, by the time we removed him from the school, we removed him before the school year was over, he was diagnosed with PTSD, anxiety, depression, suicide ideation. And the school did very little to solve the problem of bullying. So the short version is we filed a lawsuit. We settled the lawsuit. We were covered by 9 News, and then our story went across the country of what we were doing with the lawsuit. And we started being contacted by families, and a lot of Colorado families, but a lot also families across the US saying, oh my goodness, I'm going through the same thing. I don't know what to do. I don't understand why no one's helping us. And as we're going through our pain and kind of working through everything and going through this lawsuit, we decided we really wanted to be there for other families that were going through this. So I always tell people we're very far downstream. There's wonderful charities out there that do, bullying prevention, and sometimes they do education and things like that. Where we do the majority of our work, at least right now, is very downstream. The family is very traumatized. The parents are just as traumatized as the children. So we're there to help them find some solutions. We do a lot of education and we do a lot of advocacy. So I'll talk a little bit more about that later, about what we do. So we kind of set up our organization. On the next slide, it talks about, we have 3 pillars of support. So our first pillar, we call it the stop pillar. And that's where we work with the family and the school or wherever the bullying might be happening to stop the bullying. And no 2 situations are alike. It kind of depends on the school and the school district, how long it's been going on. But we do a lot of work, a lot of advocacy in this area. It will educate the parents to talk differently about bullying. A lot of times a school will say, well, your child retaliated. Well, no, they actually didn't. They defended themselves. a child who is targeted for a long time sometimes eventually will fight back. And it's um, and bullying experts will tell us that that's what happens sometimes eventually. So in the stop pillar is where we do most of our advocacy work, and we've talked to school boards. We'll go in with families and talk to the school, or we'll educate the family of how to talk about the bullying, how to document everything, to record phone calls. We're in a state where we can record phone calls here. um, our second pillar is recover. We Before COVID happened, we were doing peer recovery groups as well as adult advocacy groups. So the kids, anybody affected by bullying could come to our peer recovery groups. So we had the children that were targets of bullying, as well as sometimes their siblings would come. And we have a youth facilitator that works, and I usually work with them too, um, where we would do community service projects. We would do some artwork together. We would try to find ideas to help us heal a little bit. Sometimes meditation kind of cloaked as something else. Um, and then down the hallways where the parents met, and it was a of support for those parents to help find some solutions, to share experience with each other, and to kind of walk through this with the support of other parents. Assist, we do a lot of reaching across the aisle. I was just talking to Spark the Change before we got on about maybe how we could work together at some point. Um, I'll talk a little bit about that too. I think I have a slide about some of the organizations we work with. So we work with people that are like-minded, that want to stop bullying, as also want to help, especially with youth mental health and suicide prevention. Okay, so the next slide, I guess I kind of go into this. So we've worked with over 150 families across Colorado. We've also worked with families beyond that. Well, I know I was on the phone quite a bit last summer with a family in New Jersey where their 5-year-old was being bullied. And that's the thing I'm seeing too. The kids are getting younger and younger, and it's pretty horrific. So and unfortunately, with kids going back to school after this lockdown and all the angst that COVID and the pandemic has caused us, I think we're going to see an increase in bullying, unfortunately. So recover, that's where I was talking about. We have those peer recovery groups, the adult advocacy groups. Oh, we also sponsor community events. We have a blast at those. Our last one was right before COVID, where we had a magician and we had pizza, and we just had a wonderful afternoon, and our families get to know each other. And I noticed that most of them talk online now. They've become friends because we all have a place to meet and support one another. And so some of the under our assist pillar, some of the organizations we've worked with are American Foundation for Suicide Prevention, Autism Society of Colorado, the Unity Spiritual Center of Parker, Spark the Change. I'm a member of Spark the Change. I'm so thrilled to be part of them. But that list is it's always growing, and we have a lot more under theirs that I just didn't list out. So the next slide, I wanted to talk a little bit. Actually, I'm going to go back. I'll come back and talk about volunteer stuff at the very end. So I told you a little bit about how we started, and we, as an organization, we believe that it is up to adults to stop bullying, not children. We were blessed enough to work. We started before COVID, and it just got passed last week. We were part of getting some legislation passed in regards to bullying in Colorado. And if you're into the bills, it's House Bill 1221, 1221. And there's a couple things. What we envisioned is it's a lot bigger than what's getting passed, but that's okay. But what this new legislation does is makes school districts and schools, they have to look for the difference between conflict and bullying. So if something's reported, they need to see if it's conflict or bullying. And why that's so important is they're handled completely differently. Um, with conflict, it's normal, natural, and necessary. Children have to have conflict with one another and learn how to deal with it. And sometimes they can figure that out on their own, or sometimes they need some coaching. And that's all great and well. And so you and I might have a conflict about, I was watching the Stanley Cup playoffs last night, and I'm a huge Avalanche fan, and you might be a Blues fan. And boy, we might even be really heated about that. But it's not bullying. I'm not looking to cause you harm. I'm just looking to tell you I'm right and you're wrong. But bullying always has two things that are associated with it. So bullying is, there's always an intent to harm, as well as there's always an imbalance of power. And that one's sometimes hard to see because sometimes it's the big kid that's getting bullied. But power can be the number of kids, it could be size, it could be it can be intellect. Yeah, oh my goodness, it can be anything. And as you guys probably can figure out, children who are different in some capacity or more likely to be bullied. You saw that one of our partners is a Colorado Autism Society. We have worked with a lot of families where their child is on the spectrum. A lot of children with learning difficulties. Kids that are immigrants are huge targets. The LGBTQ plus community is another one. So we do a lot of outreaching to those communities as well. So back to the legislation, we have conflict versus bullying, as well as to discern between harassment and bullying as well, because those are treated differently in the school systems. And we, going forward, there's a Colorado model bullying policy that's updated every 3 years, and it's next year. And this new legislation will allow parents of bullied children to sit at that table and help grow that model bullying policy. So there's more stakeholders to make sure these kids are properly cared for. So we're here to talk about volunteers, and I've got 2 volunteer opportunities that are currently listed on our website. We have a community research coordinator and a community outreach coordinator. Our charity is starting a new program, a community resource program. We are reaching out across the state to contact pediatricians, crisis centers, and I just lost the other one. Boy, my mind's not fully engaged yet. Anyhow, so we're reaching across the state to let people know we exist, what our services are, how we can help parents. So we decided to start with especially the pediatricians, because sometimes they know what's going on when no one else does. Maybe the child will speak up, or maybe they will be able to identify that they're possibly are being bullied. So to get literature in the hands of those folks, to let them know there's a resource for those families. So we're getting a grant this summer, and that's what we're doing with it. We're going to reach across the state so we can work with more families. Right now, a lot of families just find us by word of mouth, or they kind of stumble across us on the internet. So we're really trying to hone in and making sure that we reach all those families that need us. So these volunteer opportunities, as you can probably imagine, there's research. We're looking to create a database of all these pediatricians and such, and then have other, or possibly the same volunteers reach out to them, describe who we are, what can we get you? Would you like some books? Would you like some literature? Would you like to talk to somebody from our organization further? How can we be of assistance to you? So those are our current volunteers, but like I said, as we're growing, the next slide talks about future volunteer opportunities. So I'm looking for probably very soon, actually, someone to help us with our website. I have someone who's wonderful who created it for us, but I need to update it quite a bit. And it's in WordPress. So if you have WordPress capabilities and are interested in probably 3 to 5 hours a month, that would be awesome. We are we're planning, the world's opening up again, so we're planning some more community events. So we're looking for volunteers for just a day to come and help facilitate those, and do check people in. I think the next one we're going to have a carnival, so help run the carnival games, serve food, and it'll be a great time. So you want to hang out with us. And eventually, we're looking for more advocates. Right now, we've got 4 advocates. They're all volunteers. Or actually, 3 of them were board. Actually, 4 of them were board members. All of them were on the board. But that's to work one-on-one with those families. And so we're creating our training on that right now. But if that's something you're interested in, to work on those with those families one-on-one, that will be available probably by the end of the summer. So I think that's all from me. I don't want to bore anybody, but there I am again. And check out our website. And if you have any questions, please contact me. And thank you so much for letting me share a little bit today.
Thank you, Drew. I know I have a couple questions. Do any of our audience members have any questions for Drew?
Drew, this is Laura, and I was just wondering, do you have any testimonies from the families that you've been able to help, and any kind of impact on the children? I know when you come on board, the harm has probably already been done to the children, but perhaps can you just address how parents and children have responded to your impacts?
That's good. Thank you for asking. So we do have some testimonials on our website, and it's mostly from the adults. Actually, it is all from the adults. We're very careful never to photograph the kids we work with. My son will tell you, and actually, so the good news with my son, I told you about when he was in middle school, he's graduating from high school this year and has done a remarkable job recovering from this. Now, we were lucky enough, we got him some mental health help as well. And he does nothing with our charity. He will tell you he does not want to be Denver's bullied child. So he does not associate himself with our charity very often. And that's quite all right. His sister does, ironically, his younger sister. But yeah, we are in contact with a lot of the families we worked with, 4 and 5 years ago. And then sometimes families recover and they just want to move far away. They don't want to be reminded of this all the time because it is so painful. And, but yeah, we, one of the, I hate to say it's a metric, but one of the things that our personal goal is to reduce the number of teen suicides in Colorado. And, it's a tragic number. I know from 2016 to 2019, we had the highest increase into teen suicides in our state. We're at 58%, with the national average at 58% increase, and the national average is 37. So we're very serious. We know that there is a relationship with bullying and suicide ideation. So that's one of our, one of the things we talk to a lot with parents is, how do you care for your child who's being bullied? You have to believe him, you have to talk to him, you have to come up with solutions together. I made some mistakes when my son came to me. He was telling me things, I'm like, it can't be that bad, it just can't be. And it was. And I so I try to share that, like, it's, you listen and you understand, and say that you're there for him no matter what. We're going to work through this no matter what. So I don't know if that answers your question. I think I went way beyond what you asked, but yeah, we do have some testimonials. And right now we're working with a family in Grand Junction. We're in the midst, so we do legal work too. We're not lawyers, but we work with some legal, some educational lawyers in town, that if it's so bad and there needs to be legal action taken, we'll help with that too. So right now we're working with a family in Grand Junction where he was physically bullied on film. So that the perpetrator is on probation, but the school knew about it. They knew that he was making threats. So we're working with possibly the school making some monetary adjustments to make sure this child is cared for. He's physically injured. I mean, he's from October, he still has injuries from the event. So not just mental, but physical. So, it's a very serious issue. So.
Drew, this is Kelly.
Okay.
What kind of requirements are involved for the advocate role, or are you still working on those?
That's a good question. The advocates that we have currently have been through this, and we've been able to help them, and they in turn want to turn around and help others. So I don't know if it's necessary, but I think you need a true passion of I want to help these families, walk through this. And I don't know if you need to have the experience of going through it to become a good advocate. So yeah, we are definitely working on like what are those qualifications. I think you have to be pretty strong. It's challenging to talk to school districts and superintendents and principals and headmasters, and because that's usually who we end up talking to. We find it's the teachers that are probably more engaged in trying to stop bullying than sometimes the administration.
Thank you.
And we do require a background check. So we work with Sterling Volunteers as well and do a background check, just because at some point our volunteers may be segued into something where they get to work with the children as well and the families.
Thank you, Drew.
Thanks.
Does anyone else have any questions for Drew? And if you don't want to talk about them now, you can certainly contact Drew afterwards. Okay. There's my girl at the door. So we'll go ahead and I'll mute, and we'll let Kelly get started. And Drew, again, thank you so much for presenting. And if anyone has questions for Drew afterwards, her contact information was up, and she is on the Spark the Change website as well. You can find her contact information there too. All right, Kelly Gruen with the Mental Wellness Program. Welcome.
All right, great. Thank you for inviting me today. I'm so happy to be here. I have to laugh because at my feet, I have a dog who is snoring. So if you hear some strange noises, it's not me. Anyway, I'll just put that out there. But yeah, I appreciate the opportunity to talk. I just want to spend today, I wasn't exactly sure who was going to come. So I have it kind of as an overview from both the host site or community partner lens and also the volunteer lens. So we can just go ahead and get started. So I have a slide in here, the next slide, Amanda, just about Spark the Change Colorado, because I just think it's important to share. And I know a lot of us are with this organization, but just to share our mission and our vision and sort of how the mental wellness program fits into this. So at Spark the Change Colorado, our mission is that we spark change and inspire a movement of good through the power of volunteerism, service, and engagement. And so everything that we do, whether it's a direct service program like the mental wellness program, or client services, or training, or engaging with older adults, everything we do ultimately comes back to volunteerism. So we envision a world with stronger, more resilient, equitable communities through the power of volunteerism. So we can go to the next. So specifically, I want to spend the time today talking about this program, mental wellness program. Really the purpose of this program is to increase access to mental health services for those who are experiencing barriers to accessing mental health care in the traditional way. And so I'm sure many of you are probably familiar with what these barriers are. We see a lot of times that this is a financial barrier. Maybe somebody is in between jobs and they don't have insurance for a time period, or they do have insurance and they're on a 6-month waiting list to get in to see a healthcare provider, or their copay is sky high and they have to pay that out of pocket, and it's just not attainable or affordable. And so really that's why we exist, is to try to help people access mental health care for free through this program. And so we can do it for free because, one, we write a lot of grants, but really ultimately because it's provided by volunteers, and we work with professional mental health volunteers who provide this service for our program. So on the next slide, I'll talk a little bit about what that looks like. So this sounds very heady, but I want to kind of dive into each of these categories here a little bit and just kind of describe how this program works. So we have a few different models in which we provide this service and in which volunteers are engaged. And I want to just go through each one a little bit, and please feel free to chime in if you have any questions throughout this. We don't have to wait till the end. I don't want this to be so formal. So please chime in anytime if you have questions. So first of all, we have what we call our private practice model. And so in this model, we have our volunteers who open up their private practices to offer up to 10 free sessions of mental health care, of counseling. And so clients can receive this service by calling our support line, which I'll reference in a couple slides down the line, so you'll have access to that number. Drew, I was even thinking when you were talking about how this, I know we're not quite ready for maybe the next step with the host site model, but if we could be a resource to any of your families, I can absolutely send you our flyer with this information too. But so just to talk a little bit about the program. So it's sometimes easier to say what we're not than what we are. We are not really well suited to deal with crisis, severe crisis. When we do get calls that seem to be crisis situations, we refer them to the Colorado Crisis Line because we're just not set up that way to provide that immediate response to severe needs in the moment. We don't have psychiatry on our team, so we're not able to provide medication management. But we really, the majority of the folks that we're working with are experiencing, in COVID, we've seen just a huge increase in numbers, a lot of isolation, a lot of depression, a lot of anxiety, all the things we keep hearing about as a result of COVID, relationship issues, grief, loss, that kind of thing. Domestic violence, substance abuse, all of those things are things we're seeing regularly in this program. So in this private practice model, when somebody calls, we do a brief pre-screen. We call that, it's not like an intake per se that a clinician would do, but it's a brief pre-screen. And what we're screening for is really, does this person have access to other mental health care services that we could help connect them with? Usually, I would say probably 95% of the time, by the time a client gets to us, they're really at the end of the rope and they've exhausted all other resources. But we just want to make sure we're utilizing this service for those who truly are having barriers to accessing the care. And so when we do this screening, we screen for that. We also screen for the crisis piece, make sure there's no real risk to the caller in that immediate moment. And from there, we refer on to our volunteers who will accept them for up to 10 free sessions in the program. So we say 10, sometimes it's longer, sometimes it's shorter. We just want to set some kind of expectation initially that this is not a ongoing forever service, but it's intended to get you on the right track. And if at the end of this session, you're still needing more help, we'll work with you and connect you to other resources if necessary, or continue the sessions. So that's the private practice model. We also have what we call the host site model, and we use the term host site kind of interchangeably with community partner. So really, this is a partner in the community that is in most cases, it's another nonprofit. We also work with some government agencies, some schools. So it's not always a nonprofit, but it's always a community partner. Some examples well, let me back up a little bit. So in this model, we actually place a volunteer clinician on site at an organization so that it serves the needs of the clientele of that organization, or guest or constituent, or whatever word is used by that particular organization. So this really provides immediate access to mental health care. So it eliminates the barrier of transportation, of scheduling an appointment. It's really intended to serve the needs where people are and when they have the need. So COVID has thrown a huge wrench in this for us, like it has for everybody I know, but right now this host site model is really just starting to ramp back up, where we're really doing a ton of outreach right now. And I think in the past week, we've onboarded about 10 new host sites. So I'm really, really excited that we can be like actually, back in person in some cases. Sometimes it's still telehealth, but we're really starting to see a shift with this right now, which is really good. So in this model, I can give some examples. I'm trying to think of the best example to give here. I'll just give a couple. So some examples of partnerships. We work with The Gathering Place, Warren Village. We have a brand new host site called Foster Source that's working with foster families and providing supports to them. We are also statewide. So in Pueblo, we work in the District 60 middle schools. We've just onboarded, I don't think that's quite the right word, but finalized a partnership with the Denver charter schools. So we'll be working in more schools in Denver. I think we have about 25 host sites right now. So we're just always looking to grow this. And of course, the more volunteers we have, the more outreach we can do for these host sites to better serve them. So, and then any questions before I move on? I feel like I'm just kind of going through this really quickly. But okay. And
Doing
then we
great.
also, oh, sorry, was there a question?
You're doing great. Keep going.
Okay. Sounds good. Thanks, Cal. So, and then we also have our supervision model, and this is pretty new to our program. We heard that there was a need in the community from folks who have graduated with their master's degrees in a mental health profession, but need a lot of hours of practical experience under a clinical supervisor. And so we started this supervision program. So through our program, we're able to offer clinical supervision to a candidate seeking licensure in exchange for volunteer hours. And so that's just really, we've heard supervision is really tricky to find. And if you do find it, it can be expensive. And sometimes you're not able to bill for your hours yet until you're licensed. So it's just kind of this catch-22. And so that's how this part of the program was developed out of that need. So we can go to the next slide, please.
Before you do, Kelly, we have a question about the supervision. What is the procedure to apply for the supervision internship?
For the internship, great. Yes, so I can speak to that a little bit. So for the internship, it's a little bit different than the candidate piece. So we are asking that the interns already have a placement before they come to us for the supervision piece. So the relationship is really between the internship and the host site or the organization agency approved by the school. There's so many parts in this. So if an intern is already placed at an agency and has that agreement with the agency and also the university, then we can come in and provide that supervision piece. And it's kind of a little bit complicated, and I'd be happy to talk to you a little bit more about the specifics of that, maybe offline. But certainly, can I ask who that question was from?
From Megan, and I just sent her your contact information.
Okay, perfect. Yeah. So Megan, maybe we can chat afterwards about that. Thank you for asking. So we are looking for volunteers always. We do require that the volunteers are licensed, and if you're still accruing your hours, that's okay, as we just talked about that candidate piece, and that you're insured within the state of Colorado. We do also ask for a background check, and ask for that you carry professional liability insurance. And just, we have some protocols that we go through when we onboard new volunteers, such as an interview and attending an orientation and all of that good stuff. So that's what I mean by established protocol of the mental wellness program. So just to list some of the benefits for our volunteers, obviously right now there is just need everywhere we turn. And so I think, just the opportunity to give back to the community is a really great benefit. One, I think, more tangible benefit is that we offer a lot of continuing education sessions for our volunteers and opportunities to network. So for the continuing education sessions, we ask our volunteers what they want to learn more about, and we really try to respond to that by providing speakers and education for free as a benefit of the program. So and then also, the requirements for license renewal. Your volunteer hours can count for license renewal, and also for, if you're a candidate, it can count towards your license. So can move to the next one. And so this is just a kind of an overview of, we are always looking for community partners as well. And some of the services we can provide, some of this is maybe a little repetitive, but a volunteer therapist to provide mental wellness service to your clients free of charge. Clinical supervision is a piece of this as well. We do extend our continuing education to our partner organizations as well. So opportunity to participate in trainings, consultation groups, networking opportunities. And then we do have this client referral piece that I'll get to in the next slide, but just an opportunity to refer your clients to free counseling through our network. And then this is something that's kind of come about more this year. And I'm guessing it's probably what we're all feeling, kind of this heaviness from COVID, and just, we need the helpers need help too. And so we've kind of had a lot of requests this year for support for staffs of these organizations. And so we've responded by providing some of our volunteers to do a training on self-care, or to do, just things that really lift up the people who are trying to provide all the help that we do in our organizations, that sometimes is really heavy. And so that's been incorporated into this program this year as well. So, and we can move on to the next. So here's our support line number. And feel free to use this yourself, share it with others who you think might be in need. This is a completely, open to anybody who could benefit from this. As I mentioned before, these little images are just kind of the typical, common things that we see, but really feel free to circulate this widely if you have the opportunity. And I see Maddie put it in the chat too, so thank you, Maddie. And we can move to the next slide. One other program that was born during COVID is called our Kind Connections program. And I just want to mention this as well. This program is housed in the mental wellness program, although it is a little bit different. It is intended to be a connection. This started last March, when we were all just starting this journey and feeling like there was nobody in the world that we could talk to, because we're all, just in our own little silos. And so we started this program where folks can request a call if they want to just have a friendly connection with somebody. It's not counseling. It's not the same as the mental wellness program. It's really intended to be a friendly voice that you can count on once or twice a week, that is going to call and support you. So we found, this is kind of cool. I don't know that this was necessarily our intention, but it worked out that these two programs really feed off each other. There are some, and I just had this today, I had a guy call where he was calling for counseling, and I probably talked to this guy for an hour. He was an older gentleman who lives by himself, had a stroke 2 years ago, can't drive anymore. He lost his ability to read, and he's just lonely. And I just said, it sounds like maybe you could benefit from Kind Connections. And I told him about it, and he was so excited. So sometimes, we get referrals for this from our therapists, and sometimes it goes the other way too. We get calls from our Kind Connections volunteers that say, this person, I don't think they're doing so great. I think they could really benefit from some additional, support of a therapist. And so that's why I mentioned this here, because it really is kind of goes back and forth between the mental wellness program. And I thought that I put this on here, but I see that I didn't. If you know of anybody who's interested in it, there is a form on our website that you can go in, and it's very simple. You put your name in, your phone number, if you have any special interests, and you just click submit, and it goes to one of our staff members, Cindy, and then she connects those folks with a volunteer for the call. So that's that. And then here's my email address if you have any questions. Of course, I'm happy to answer any questions now. But otherwise, you can email me or anytime. So.
Well, Kelly, this is Laura. And I just want to mention how responsive the mental health wellness program is. 2 months ago, when we had the King Soopers mass shooting, Spark the Change was able to put together flyers that referenced crisis lines as well as themselves, just to be able to have community members who were impacted by this horrible tragedy. And we were able to, also because of the connection that we have with Starbucks program, and I forget which leadership program or what it is, Kelly, but we were able to put these flyers in the Starbucks that were nearby the King Soopers. And I just thought, and I know that's not the first time you've responded to something like what we experienced in Boulder. So I just want to say thank you. I think it's an awesome program.
Thank you so much, Laura. And I have to say, we have the most incredible volunteers. When that happened in Boulder, I sent an email to our volunteers, and within an hour, I had several responses. And some were involved in the Columbine shooting, so they had very extremely relevant experience. One was involved with 911 in New York City, and I was just amazed by the experience and the generosity that poured out after that. I mean, I feel like our volunteers are in this program because they care so deeply about our community, and it's just amazing to see. And but thank you, Laura.
Thank you both. Any questions for Kelly? We've been looking at the chat, and Maddie has been putting up connections, the websites for the Kind Connections for both mental wellness program and the bullying recovery resource center. So there are the website connections for both programs there in the chat. In addition to, here are the connections here. Any other comments, questions, kudos?
I just want to thank the presenters. I think both of these programs are awesome. And bullying and mental health issues really touch so many more people that we're unaware of, just in the general public. And so your impacts are huge, and just thank you for doing what you do.
Thank you, Laura. I completely second that. And thank you so much for taking the time today to present. yes, Megan says this was such great information that she can share back with her team. Thank you. Thank you, Megan, for that comment. And we just really appreciate you presenting. This recording will be shared on our website, as well as with all of the folks that weren't able to make it today, and in social media. So the recording will have a farther reach than we thought today. So, and then your impact will carry on as well. And for all of our guests, you can continue to contact Kelly or Drew after the session and continue connecting or asking questions, and hope we find some great placements. Please note that our next Community Connection event is June 23rd, and that's for anyone interested in getting kids, finding opportunities for youth of various ages to volunteer, and that could be in all different interest areas. So please join us in June. Oh, which, speaking of, Drew, do you have any at your carnivals or your community connection events? Are there opportunities for youth to volunteer as well?
Yeah, I think so. I mean, I'm hoping to get some youth. That's a great idea. Thank you, Kelly. We're still getting the dates and the magician lined up, but yeah, I will definitely put that up under, because it'd be fun to have youth hosting the carnival games and things like that.
Fabulous. Get those posted, and I'll be thrilled to share your opportunities at the next event too.
Excellent. I will. Thank you.
Thanks, Drew. All right. Well, thank you so much, everyone. I'll let you go back to your gloomy day and hopefully have some hot cocoa and cheer things up. But thank you so much, Kelly and Drew. This was very a spark of hope that great resources are out there to help everybody and anybody. Thank you so much.
Thank you all. Thanks for having us.
Thank you. Take care. Thank you.